Family and diabetes. Is diabetes a family disease? Diabetes is characterized by a complex set of disorders which leads to persistent hyperglycemia. Two common types are type 1 and type 2. Other rare forms like MODY, maturity onset diabetes in young, and diabetes due to mutations in mitochondrial DNA are also seen. Is type 1 diabetes hereditary? Type 1 diabetes is rarely hereditary, but it is an autoimmune disorder where the body's own immune system destroys the pancreatic beta cells, which leads to insulin deficiency. Hence, the patients develop type 1 diabetes. It is usually seen in childhood, called as juvenile diabetes, where the patient ends up in taking insulin for lifelong. Type 2 diabetes is hereditary. It runs in families. Two common risk factors are genetic factors and the environmental risk factors. These two risk factors leads to insulin resistance, where the body uses less insulin, hence the patients develop diabetes. So if a patient stays healthy, if he is physically active, follows proper food habits, he can prevent from passing on the diabetes to future generations. Women and diabetes. Women with diabetes are more likely to have a heart attack at a younger age than women without diabetes. Diabetes increases the risk of heart disease by about 4 times in women, but only about 2 times in men. And women have serious outcomes after a heart attack. They have lower survival rates and poor quality of life after a heart attack. They end up in developing depression, which is 2 times more common in women compared to men. They have higher risk of developing blindness, which is a common complication of diabetes. Women and pregnancy. Diabetes can occur in pregnant women. It is usually seen in the 5th month of pregnancy and it is called as gestational diabetes. Type 1 and type 2 diabetes patients can also become pregnant, but they should ensure that their blood sugars are under control. They should have an HbA1c of less than 7% and then plan for pregnancy. Gestational diabetes patients should check their blood sugars post-delivery after 6 weeks and ensure that their blood sugars are normal, because 2 to 3% of the gestational diabetes mothers end up in developing diabetes. So what are the risk factors for women to develop diabetes? Obesity is the major risk factor, followed by family history of type 2 diabetes, previous gestational diabetes, previous child weighing more than 4 kgs, high blood pressure, high cholesterol, polycystic ovarian syndrome, etc. are the risk factors for women to develop diabetes. What is the importance of lifestyle modification in diabetes? What is the daily routine in managing diabetes effectively? A patient should eat a healthy, balanced meal consisting of fresh fruits and vegetables, whole grains, and low fat containing foods. They should eat the right portion of the healthy foods. Eat foods that have less salt and fat content. They should get at least 30 minutes of physical activity or exercise on most days of the week. 30 minutes a day, 5 days a week is recommended. They should replace refined carbohydrates with whole grain foods and increase intake of vegetables and other foods which are rich in dietary fiber. They should choose a calorie-free liquid such as unsweetened tea, coffee, or water. They should choose sugar substitutes instead of adding direct sugars. They should eat lean meat instead of red meat, and low fat dairy products are recommended. They can take nuts, seeds, and fatty fish, and they can take animal proteins less. Instead of that, they can take more of plant proteins, etc. Managing stress in diabetes. So managing stress is most important for a diabetes patient. Stress increases the blood sugar levels. Anxiety also makes managing diabetes difficult. So when a patient is under stress, he may skip his meals, he may forget to take his medicines, hence the blood sugar rises. So how to manage stress? So stress can be managed by getting involved in physical activity like walking, jogging, breathing exercises, yoga, meditation, relaxing hobbies like shuttle, badminton, listening to music, etc. Most important is a patient should have 7 to 8 hours of sound sleep. So if a patient sleeps well, stress levels reduces and he can have a good control on his blood sugars. And most important is he should stay positive. So diabetes care is under one's own control. So if he is able to follow his part properly, he can lead an healthy, active and successful life. So medicine adherence challenges of the patients. So medication adherence or taking medicines properly is defined as the extent to which the patients take their medicines as prescribed by the doctors. So what are the common barriers in medication adherence? The most important factor is the inability to buy medicines. Second is disbelief that the treatment is necessary or helping. Third is difficulty in keeping up with multiple medications and complex dosing schedules. And the last one is confusion about how and when to take the medicines. So poor adherence can interfere with the ability to treat the diseases, which leads to greater complications and a lower quality of life in patients. So what are the tips to manage medication adherence? So take your medication at the same time every day. Try taking your medication with daily routine like brushing your teeth and getting ready for bed. Keep a medicine calendar with your pill bottles and note each time you take a dose. Use a pill container. While traveling, be certain enough to carry extra medicines in case your return is delayed. So, the main challenge in diabetes management is medication adherence. Only about 31% of the patients with type 2 diabetes have an HbA1c of less than 7%. This is because they have poor adherence in taking the medicines. So this can be overcome by taking combination medicines which suit the patients, such as extended release formulations and medicines that can cause less hypoglycemia, etc.